Hello, the topic of lecture is modern treatment options of caries and its complications. Lecture outlines such questions: introduction, basic physics and biological interactions of laser, use of lasers in endodontics, use of lasers in conservative dentistry, advantages and disadvantages of lasers use, safety rules with lasers, and air abrasion method of cavity preparation. So caries, it is the most common cause of toothache and tooth loss in adults and children, and it is widely acknowledged that this is a bacterial disease and must be treated as such. And here you have this schematic diagram that gives you the main etiological reasons. First of all, for caries, should be susceptible tooth surface, appropriate highly rich in carbohydrates diet, microorganisms that are constantly colonize oral cavity, and of course time during which these factors co-interact together. And don't forget about saliva, because saliva, it is that environment that helps to maintain healthy condition of the oral cavity, and organs of oral cavity constantly stay in saliva. Thus, it helps either to prevent disease, or if there is a xerostomia, it will lead to diseases of oral cavity, of course, of teeth. And next, that however, the purely surgical approach to caries control, as it was taught by Green, Vardyman, and Black, is now recognized as being far too destructive to be used at the first line of defense, and it is highly inefficient because it does not eliminate the cause of the disease, and at the same time it leads to continuing process of replacement dentistry, where the cavity just gets larger, as you can see, and the restoration is subjected to an increasingly heavy load, and the tooth, as a result, gets weaker. Moreover, there are many patients who are anxious about visiting a dentist. This is due to the fact that a visit to the dentist is always associated with a pain. Local anesthetic drugs and techniques can address the demands of care delivery, but still, there was a desire to find a clinically acceptable replacement to the dental turbine. For these reasons, new methods of caries management are being developed, such as laser treatment, particularly using erbium lasers. Lasers in dentistry made their debut back in 1994, but study of lasers, introduction them into different fields, were done earlier, of course. So what is laser? This definition here you have. It is abbreviation, and behind this abbreviation stands such terms: light amplification by stimulated emission of radiation. Actually, that is definition to laser. So as you can see, it is a medical device where you have where we can see the beam of laser, hydrophotonic energy, and of course water supply should be given. Timeline of lasers development and their use in dentistry. So the first establishment of laser were done by Albert Einstein. He established theoretical foundation for laser, quantum theory of radiation, but he did not at that time talk about lasers. Later, in 1960s, actually this was that person, Meinman. He operated the first functioning laser, ruby laser, at 694 nanometers wavelengths. Later, it was 1963, were done some dental researchers, done research about use of laser in dental practice at California University. 65, Taylor reported extensive hemorrhagic necrosis and disruption of odontoblastic layer. 70, carbon dioxide laser were introduced. 74, Stern observed resistance to acid penetration into enamel, suggesting role of laser in caries prevention. 84, Meltzer and others researchers reported successful treatment of over 1,000 patients in clinical trials of caries removal. 87, it is concluded that laser could induce secondary dentine formation and sterilization of dentine and exposed pulp. In 1995, in 1997, Fédération Dentaire suggested to use laser device for gingival surgery and use of laser in treatment of tooth decay. And actually from this time we can talk that lasers were officially introduced into dentistry. And of course, as I wrote here, further development is continued, new techniques are developed, and researchers are not staying on their place and always move ahead. So how do laser work? A proper understanding of dental lasers' potential is not possible without a basic understanding of laser physics and biological interactions. So all lasers work by delivering energy in the form of light. When used for surgical and dental procedures, the laser acts as a cutting instrument or a vaporizer of tissue that it comes in contact with. When used in teeth whitening procedures, the laser acts as a heat source and enhances the effect of tooth bleaching agents. So this diagram can actually shows how it works. So it is laser beam directed to the area of decay. Necrotic tissue contains more water molecules than the rest of the tooth. After that, water molecules in the decay are heated rapidly due to a source of heat. Pressure increases and this area of necrosis explodes, making special popping sound. At the same time, laser kills microorganisms that are present in this necrotic area. So there is no necessity for further antiseptic treatment of caries cavity prior restoration of it. So it is considered to be beneficial of laser use. The interaction of hard tissues and erbium laser. So the mechanism of dentine removal by erbium laser involves a thermomechanical process in which the emission laser light is absorbed by the water within the hydroxyapatite of the dental hard tissue. The water is then heated and evaporated, resulting in high-pressure steam that causes a micro-explosion of tooth tissue below the melting point of tooth tissue, approximately 1,200 degrees Celsius. The surface irregularities of ablated dentine are comparable to those of the dentine surface after acid etching. It's important. And this may promote micromechanical interlocking between dental restorative materials and the tooth surface. That's why after laser use in cavity preparation, there is no need to apply etching gel because micro pores will be present. Here you have different modes of light emissions. different laser devices have different working mode, and here are these possible. So continuous mode. In this mode, there is no thermal relaxation. Here you have this definition. What is thermal relaxation? Thermal relaxation refers to the ability of the target tissue to absorb heat produced by laser interaction. So in this mode, there is no thermal relaxation at all, and potentially damaging heat can destroy the tissue quickly. Gated wave mode presents basically a half-on-half of exposure to laser energy, and the ability of the tissue to absorb the heat is limited. Free-running pulsed lasers has the greatest thermal relaxation, and they are favorites. So each pulse is temporally very short, from 50 to 1000 millionths of a second. There is adequate time between each pulse to allow the tissue to absorb and dissipate the heat to minimize thermal damage. It results in the lowered postoperative discomfort and contributes to the ability to perform many operative dentistry procedures and even some soft tissue procedures without local anesthesia due to this ability of due to this mode, free running pulsed mode. And here's very simple explanation of how laser works. So if a finger is moved rapidly through the flame of a candle, it will not burn, and the tissue can absorb and dissipate the momentary high heat exposure. If the same finger is moved slowly through the flame, it will get burnt eventually. And placing the finger in the flame and holding it there for some time, for sure it will cause rapid thermal damage. So actually, this very simple explanation gives you an idea of how laser work. Actually, it is free running pulse mode. In this table, I have arranged all possible types of lasers that are used in dentistry and their tasks. So carbon dioxide laser works with the wavelengths of 10,000 nanometers, and he has such tasks. He is used for soft tissue incision, aesthetic contouring of gingiva, treatment of ulcers, frenectomy and gingivectomy, deepithelization of gingival tissue during periodontal regenerative procedures, neodymium doped yttrium aluminium garnet. Wavelengths is 1000 more than 1000 nanometers, 1064 nanometers. It has similar to above function, but as well it is used for removal of incipient caries of enamel, though due to depth of penetration there is a greater risk of collateral damage than with dioxide lasers. Erbium lasers works with wavelengths of 940 nanometers. Erbium, chromium, yttrium garnet works with these wavelengths, almost 3000 nanometers. And the task for erbium, chromium garnet is such: caries removal, cavity preparation in both enamel and dentine, preparation of root canals. Diode lasers 800 till 1000 nanometers is efficient for gingivectomy, frenectomy, tooth bleaching techniques, treatment of ulcers using photobiomodulation therapy. So this diagram gives you idea in what areas of dentistry laser can be used. So almost in every discipline of dentistry it is advocated. For surgery procedures, for endodontics, for periodontology, and if it goes about oral mucosa diseases, it acts as a biostimulator for treatment of ulcers, for example, aphthous ulcerations, and so on. So every field of dentistry can use lasers. And now in short, I would like to stop on special use of laser in conservative dentistry. So the use of lasers not only help in providing effective preventive dental treatments, but it also helps in reducing the patient's anxiety and incorporating patient-friendly approaches to dental care. And here are some of the preventive dental treatments that employ lasers. First of all, it can be used for caries detection and removal of decay, and at the same time removal of dental fillings, for example, composite material and glasionomer fillings. But it is prohibited to use laser for removal of gold or ceramic fillings or amalgam, because there is a potentiality for mercury vapors release. In diagnostic process is used such device as Diagnodent pen, company Cavo. Probe-like pen, for example, it's synonym to this. It is a tool for detecting a hidden caries in pits and fishes, those that is impossible to see by naked eye. In caries prevention, laser use as well. So laboratory studies show that laser treatment of enamel can inhibit caries progression by 50%. One-time laser treatment equal to daily fluoride treatment. Laser irradiation of dental hard tissues modifies the calcium to phosphate ratio, reduces carbonate to phosphorus ratio, and leads to the formation of more stable and less acid-soluble compounds. Critical pH for enamel dissolution was reportedly lowered from 5.5 to 4.8, and the hard tooth structure was 4 times more resistant to acid dissolution after applying of laser. In the detection of caries, lasers used as well. So first of all, the main method of how to detect caries, it is probe, mirror, visual examination, but and of course X-ray. But in a case if caries is on the beginning, on the initial stages, moreover it is in the proximal surfaces, those that is hard to examine. For these cases can be used this device, Diagnodent probe-like pen, and it will detect hidden caries. So Diagnodent it is a portable battery-powered diode laser, 655 nanometers of visible light. And actually, these cause active caries to fluoresce. The amount of fluorescence is measurable and is correlated to the size and direction of the lesion. And here you have this numbers that can be seen on the screen of this device. For example, here you have this data. Numbers from the 0 till 10 will indicate that tooth structure is healthy. If it is 11 till 20, it means that outer half has enamel caries, and more than 30 indicates dentine caries. To maintain this procedure, necessary to remember these few key points. So first of all, teeth must be free of organic stain, plaque, calculus, and these substances tend to have a high degree of fluorescence. If there is a written movement, it displays is a real-time reading. Peak indicates actually, it display holds the highest value attained until it is reset by one squeeze of the gray ring. No, actually, necessary to have this device and then look at it, and everything will be clear after reading the instruction of how to use it. So one more, Cavo company Diagnodent is indicated in such cases. Class first, class fifth, and incisal caries, class third and class second lesions when used with visual examination, X-ray, and transillumination. Laser caries detection can also be used intraoperatively to check minimally restorative preparations for complete decay removal and helps in decision-making process to restore or not to restore. Sometimes really it is useful to have such an extra method of diagnosis. So I propose to your attention this small video about Diagnodent. Okay, it was in a very clear manner explained about Diagnodent. And next, a procedure that can be done with a laser in conservative dentistry, it is treatment of dentine hypersensitivity. Let's memorize what is dentine hypersensitivity. It is a condition where an individual has an exaggerated response to hot or cold stimuli, such as cold, heat, evaporation, tactility, osmosis, or chemicals. And the first mechanism implies the direct effect of laser irradiation on the electric activity of nerve fibers within the dental pulp. Whereas the second mechanism of hypersensitivity treatment involves modification of the tubular structure of the dentine by melting and fusing of the hard tissue or smear layer and subsequent sealing of the dentinal tubules. And actually here you have this dentine tubules with odontoblast processes and hypersensitive area. And here this picture shows you the use of diode laser for treatment of hypersensitivity in cervical area. The lasers used for treatment of dentinal hypersensitivity are divided in two groups. The first group, it is low output power lasers, for example, helium neon and gallium diode lasers. And second group, it is middle output power lasers, neodymium lasers and carbon dioxide lasers. Helium neon laser uses an output power of only 6 microwave, which do not affect the morphology of the enamel or dentine surface, but allows a small fraction of the energy to reach the pulp tissue and stimulate nerve cells. Neodymium laser effect on dentine hypersensitivity is thought to be laser-induced occlusion or narrowing of dentinal tubules, as well as a direct nerve analgesia. Laser-activated fluoride therapy. So this therapy involves irradiation of the dental enamel with dental lasers at particular wavelengths after applying the fluoride. This works against the acids and other agents that produce dental caries. The fluoride that gets attached in this process helps in fighting dental caries. And technique is such. Sodium fluoride varnish is applied to the tooth surface, and then irradiation of the cervical, here it was applied to the cervical portion, so irradiation should be directed as well to the cervical portion of the tooth with a diode laser tip. Caries management using laser. For caries treatment, erbium lasers are used. Erbium lasers and chromium lasers. It is multi-tissue lasers with extremely short pulses and high peak power. They allow for efficient enamel and dentine photoacoustic ablation. Actually, this is the process, photoacoustic ablation. Erbium lasers can prepare all classes of restorations. Many restorations can be accomplished without local anesthesia. Pay attention, patient has black glasses to protect eyes, and the same should have dentist to protect his eyes as well. Such machine, BO-Lace water laser. It was developed in 1998, and it has such characteristic. It uses a process which gently washes away decay with laser energized water droplets. Hydrokinetic energy is produced by combining a spray of atomized water with laser energy. The result is the energized water gently and precisely removes a wide range of tissue, including tooth enamel and soft tissue, such as a gum tissue, with no heat or discomfort in most cases. And one more video that shows how laser prepares caries cavity. Let's watch. Actually, on this video, they both found laser. все рівно в мене лекції. Нікуди лекція. Є, але я не лекція. Зараз ще відео дивлюся. Attention that all feelings of release is the surface of the cavity preparation. It is like of the edge. They didn't actually apply any edge extension, just apply adaptive system. Distributed it and light cure. And actually, right now, it is supposed to be restoration with Filtec 3M restorative material as usual. So the main key point, no etching, and actually enamel looks like after etching, porous and white. By the way, why they decide to use laser for cavity preparation? Because composite material has more water in comparison to hard tissues of tooth. That's why it is sparing preparation. There is no danger that enamel or dentine will be removed. Only composite material will be replaced, and tooth tissues will stay because laser have selectivity. Actually, here it is written, tissue selectivity of erbium laser make an advantage in the removal of old composite fillings. So for that reason, this device was chosen. Advantages of using erbium laser for operative dentistry include these key points. So precise ablation allows for minimally invasive preparations, smear layer removal, disinfection of preparations, eliminates the noise, heat, and vibration of high-speed rotary instrumentation for those patients who are afraid of these sounds, reduce need for local anesthesia, selective caries removal due to caries dentine's higher water contact and softer consistency, cases which require direct pulp capping. In case of an accidental non-caries exposure, erbium laser can be used in a defocused mode to partially necrose the superficial tissue, thus creating a protective barrier around the exposed pulp tissue. Lasers in endodontics. Laser treatments have been proven to have many advantages over conventional methods. Results suggest that the laser is an effective tool for the removal of debris, the smear layer and obturation materials, as well as being an effective disinfection tool in endodontology. Okay, so endodontic therapy, it is a sequence of procedures aimed at eliminating pulp infection and protecting the tooth from future microbial invasion. It consists of such procedural steps. Here are they: enlargement of the root canal, removal of infected tissue, disinfection of the root canal, tight final root obturation. Tight final root obturation. So these are conventional steps in root canal treatment. And this diagram shows you limitations to conventional root canal treatment. So conventional procedures use mechanical tools and toxic disinfection agents and have such disadvantages. First of all, On average, more than 30% of the canal surface area remains covered by a smear layer, which protects bacteria in the dentinal tubules against intracanal disinfection agents. Intracanal medicines have a limited antibacterial spectrum and a limited ability to diffuse into the dentinal tubules. The conventional mechanical removal of obturation material is time-consuming. So these are limitations. For that reason, laser can be used as option for endodontic disinfection procedures. Types of lasers that are used in endodontics. Near-infrared laser, such as neodymium, with such wavelengths, are not absorbed by hard dentinal tissues and have no ablative effect on dentinal surfaces. It has a disinfecting effect on the deeper dentine layer due to its thermal effect. The medium infrared laser, such as erbium laser family, have flexible fine tips. They are well absorbed by the water content of the dentinal walls and therefore have a superficial ablative and disinfecting effect on the root canal surface. The far infrared laser, carbon lasers, was the first to be used in endodontics for disinfection and in retrograde preparation. It is no longer used except for in vital pulp therapy, such procedures as pulpotomy or pulp coagulation. So here, given that types of lasers that are available to use in endodontology. Application of laser in endodontics. First of all, it can be used as a diagnostic tool. Second, analgesia. Third, dentinal hypersensitivity. Fourth, for vital pulp therapy, pulpotomy, direct pulp capping, and indirect pulp capping. Next, it can be used for root canal treatment, such as excess cavity preparation, orifice location and enlargement, preparation of the canal walls, irrigation and disinfection of infected canals, obturation of canal, removal of gutta percha obturation material, removal of temporary cavity sealing materials, root canal sealing materials, and fractured instruments in root canals. Next, it can be used for vertical root fracture diagnosis and treatment, and 7, endodontic surgery, flap preparation, incision of soft tissue to prepare a flap and expose the bone, cutting bone to prepare window access to the apex of the roots, apicectomy, amputation of the root end preparation for retrograde treatment, removal of pathological tissues, in example cysts, neoplasm, or abscesses, and hyperplastic tissues, in example granulation tissue from the area around the apex. So this diagram shows you all possible application of laser in endodontology. As a diagnostic tool, can be used laser Doppler flowmetry device. It was developed to assess blood flow in microvascular systems, but is now also being used for diagnosis of blood flow in the dental pulp. So technique. The laser beam is directed through the crown of the tooth. It passes through the blood vessels within the pulp. The moving red blood cells cause Doppler shifts in the frequency of the laser beam and backscattering of some of the light out of the tooth. Use of lasers for pulp sensitivity testing offers the advantage of not relying on a painful sensation for diagnosis. For these procedures can be used helium neodymium and diode lasers at low power of 1 to microwaves are used, watt are used, microwatt are used. Lasers for analgesia. Such scheme of analgesic technique. First of all, laser wave interfere with sodium pump mechanism of cells, change cell membrane permeability, alter temporally endings of sensory neurons, and block depolarization of C and A fibers of the nerves, and thus analgesic effect is obtained. For this purpose, the pulsed mode of neodymium lasers are used. Biomodulation or biostimulation procedures. For this low-level laser, so it is called as well low-level laser therapy. It involves the use of visible red and near-infrared light with tissue in order to stimulate and improve healing as well as reduce pain. Such laser as helium neon laser with a wavelength in the visible light spectrum 632 nanometers and a low power output of 1 to 5 milliwatt are used. As example, I suggest this Teradent laser. It is a unique combination of 4 radiances, which is perfect for optimal pain relief and quickened healing. Say a Teradent laser for low-level laser therapy, helium neon laser, such device. With different tips, as you can see. So once again, I will repeat, these are used for photobiomodulation or biostimulation procedures. In therapeutic dentistry, lasers can be used for treatment of dentine hypersensitivity, wound healing in dentoalveolar, abscess, gingivitis, and periapical granuloma, postoperative analgesia following periodontics, oral surgery, and endodontic procedures, treatment of recurrent ophthostomatitis and rheumatic ulcers, reduction of oral edema, treatment of recurrent intraoral and labial herpes, management of inflammatory conditions such as erosive lesion planus. Actually, this one possibly can be advocated for this condition, lesion planus. Schematic representation of how the working end of the laser directed to the mucosa of gums, to the mucosa of lips, and according to the indications for a few minutes this irradiation is done. So it was application of laser in the treatment of oral mucosa pathology as a photobiomodulation strategies. How does low-level laser therapy benefit patients? Actually, here you have the answers. It relieves acute and chronic pain. It increases the speed, quality, and tensile strength of tissue repair. It increases blood supply. It stimulates the immune system. It stimulates nerve function, develops collagen and muscle tissue, helps to generate new and healthy cells and tissue, promotes faster wound healing and clot formation, and of course reduces inflammation. So here all benefits that patient will obtain after the treatment of oral mucosa with low-level laser therapy. In the procedures of pulpotomy or pulp amputation, in a conventional method were used formocresol. Formocresol right now is considered to be a toxic agent, and in United States it is prohibited for use now because there are evidence that this material can lead to cancer. It has carcinogenic effect. That's why formocresol is prohibited in USA. And for opposite, they suggest to use instead of this medicament laser therapy for pulpotomy procedures, because laser has a more favorable response of tissues compared to formocresol. Root canal treatment. So in various laser systems used in dentistry, the emitted energy can be delivered into the root canal system by a thin optical fiber, neodymium, erbium, chromium, yttrium, scandium, gallium, garnet. Such abbreviation and such definition of it. Argon and diode, or by a hollow tube, carbon dioxide and erbium lasers. Thus, the bactericidal effect of laser irradiation can be used for additional disinfecting the root canal system following instrumentation with the traditional methods. That means that traditional instrumentation cannot be replaced. A laser can be extra support for better disinfection of root canal, but no one replace traditional way of root canal instrumentation. And here I suggest one more, the final video that deals with how laser is used for antiseptic, for endodontics, actually, the use of laser in endodontics. Okay, as you can see, they apply sodium hypochlorite, of course, rubber dam should be right, affected of with all techniques. So such scheme instrument, the root canals follow a traditional scheme of instrumentation. Some antiseptic solution into it, and then inside laser biolaser, by the way, always laser. That's all is done in the root canal. Activate still some necrotic dentitis left in lateral canals, and microorganisms cannot be washed out from lateral canals just with applied antiseptic. That's why this extra use of laser helps to remove all microorganisms, all debris from lateral canals, and thus better antiseptic. At least stay for a long time without treatment. They dry. Sorrow, dry, very sorrowful the root canals. And once again, put diode laser disinfection in dry canal. Continuous wave mode. They use this sealer, total peel sealer for obturation with a sealer. Sealer is available in syringes. They introduce it into the root canal by injecting. And then gutta percha is inserted. Master cone of gutta percha is inserted. And extra points as well inserted to fulfill the whole space of the root canal. And excess of percha was stopped. And now with the plugger it is condensed. And here you have the final look of the tooth cavity with sealed root canal. Now they apply etching gel, and do restoration of this tooth crown with and do light cure. Apply bonding agent, do light cure. And apply light curing material, Gradia. Apply post for better fixation of the crown. And final finishing and shaping of the core build-up. And of course, X-ray were done to check the quality of root canal treatment. Okay, that's all. And actually, this mechanism that was shown on the previous video, pipes, photon-induced photoacoustic streaming. Actually, it is responsible for better cleaning of lateral canals. So, definition: the extremely high peak power and affinity for water of the erbium laser creates an interesting phenomenon when specially shaped radial firing tips are placed in irrigant solution. When these special tips are submerged in solution, each pulse sends a powerful wave of acoustic energy throughout the solution. The resultant shock wave propagates throughout the complete three-dimensional root canal system, even the tiniest accessory canals. And scanning electron microscope and microbiological studies have shown extremely thorough cleansing and disinfection of the root canal complex. So here you have this schematic representation of this technique. And this technique allows the dentist to instrument less aggressively and still achieves a thoroughly clean root canal system. Photon-induced acoustic streaming pipes as well. Here you have I have prepared this video, and it is revolutionary new wave to more thoroughly clean the complex anatomy that is found inside of the tooth. And this technique is only possible with the power-lace dental laser. Few seconds. Okay, so this technique, actually, it's not technique, it is phenomenon, revolutionized the endodontics and instrumental treatment of root canals and antiseptic treatment as well. So here you have the collected indications and contraindications for laser-supported endodontic treatment. First of all, laser-supported treatments should be favored when treating patients that show one or several of the following symptoms: teeth with a purulent pulpitis or pulp necrosis, teeth of which the crown and root pulp show gangrenous changes, teeth with periapical lesions, periapical gap from 1 millimeter up to granulomas with a diameter of 5 millimeter and more, teeth with a periapical abscess, teeth with lateral canals that lead to periodontal involvement, absorption of the apex caused by inflammation or trauma, teeth that have been treated for at least 3 months without success with alternating rinsing and medicinal inlays. So it is indications and contraindications. And safety rules of how to work with laser. First of all, we need to protect ourselves, our eyes, and patient's eyes. And such quotation that were said by such person, as you see here, Strazel Martin, and only twice you can make mistake with a laser. First you lose one eye, and the second your other eye. So let's keep in mind this and follow recommendation of safety rules. So personal protection, it is eyewear, goggles and safety glasses, saline-soaked gauze, clothing and masks. Administrative controls, standard operative procedures, warning signs, protective devices, training and education. Engineering controls, equipments, label, key switch, protective housing, warning systems, beam enclosures and special controls, fire and explosion, repair and maintenance, fiber optic delivery system. It was safety rules for lasers. And limitations of laser use. Special training and attention for safety. No single laser can perform all desirable dental application, and of course this device is expensive, and training of personnel as well costs some money. Air abrasion technique. We successfully come to air abrasive technique. So air abrasion, also called kinetic cavity preparation. Particle beam or kinetic abrasion technology uses the kinetic energy of microfine 20-50 micron diameter particles of aluminium oxide in a high pressure airstream to remove tooth structure by brittle microfracture. Technique of air abrasion is such. First of all, using air abrasive unit with high volume evacuation placed in the proximity of the caries cavity. After a few seconds of initial preparation, examine the preparation for decay. Reapply caries detecting dye to check quality of cavity preparation, and complete the preparation using the caries detector until all caries is removed. Here you have steps. So first of all, fissure caries is present here. Then tip of the air abrasive device is applied to this fissure. This diagram shows you prepared fissure with air abrasive technique, and cavity is restored with resin composite material. Indications of air abrasive method. It can be advocated in such cases. Teeth where the caries is restricted only to a small section of the tooth, surface preparation of abfractions and abrasions, removal of existing restorations. The use of local anesthesia while walking in dentine may be avoided because of their cooling action through high pressure air. And such a device, example, prep start. It is air abrasive device. Advantages and disadvantages of air abrasion technique. Advantages as such: a reduced need for local anesthesia, as well as a reduction in the annoyance factor for the patient. However, the use of rubber dam is strongly recommended to help control the distribution and inhalation of the dust. And disadvantages as such: air abrasion will not effectively remove the smear layer from dentine, and it is important to keep in mind. But razor creates it. Acid etching should be used to remove the smear layer prior to bonding of resins to dentine. However, it must be noted that large areas of soft and infected dentine are not hard and brittle, so it has limited ability to undergo brittle fracture. And in a conclusion, it can be said as follows. First of all, it is important for the dental practitioner to become familiar with the modern principles of treatment options of dental diseases, and then choose the proper device for the intended clinical application. Second, dental lasers are now well established in the dental armamentarium, and their future potential is even greater. And third, clinician who understands basic physics and biological interactions of laser can take full advantage of the device and thus can provide safe and effective treatment. And finally, that I want to say for you, like a quotation of the father of the modern dentistry, Green Vardiman Black. He said that the professional has no right to be other than a continuous student, and I hope that you will go deep into your in your study. You will increase your knowledge, and moreover, we talk about this sentence quotation in the light spot of continuous education, lifelong education. So wish you to be constant students and good professionals at the same time. Such references were used. It was books that deals with lasers. Such article I have used from this journal, Lasers in Surgery and Medicine, and from this as well, International Journal of Laser Dentistry. It was very effective and efficient for me. And such book, Springer Publishing, Lasers in Dentistry, Current Concepts. So that's all. Thank you for your attention and have a good day.
Thank you, Doctor. Goodbye.
Goodbye.
Thank you very much, ma'am. Have a nice day. Goodbye.